Good afternoon, everyone, and come on in. As we get everyone to get into the webinar, I'll give you all just a couple of more minutes. As we do that, if you can tell us where you're from and your name in the chat box, that will be our little introduction for this morning. So if you can just introduce yourself by telling us in the chat, by sharing your name and where you're joining us from. And I'll give us maybe one more minute to get everybody into the webinar. All right, guys, we'll go ahead and get started. Continue to put your introductions into the chat. And remember, that is your name and where you are joining us from. So good morning, everyone, and thank you for joining us today. My name is Asiria Daniels, and I'm the Program Manager for Self-Made Health Network. I'm super excited to welcome you to our final webinar today in the Upstream Approaches in Cancer Prevention, hosted by the Tri-Network's Cancer Prevention Community of Practice. The topic today will be introduced to the built environment approaches for addressing health. Next slide, please. So before we get to hear from our esteemed presenter today, we'll go over a couple of house rules. All participants are muted by default, so please use the chat box for any general comments. If time permits, we will have a Q&A session after the presenter, okay? So remember that aspect. And if you have any specific questions while our presenter is speaking, you are allowed to use the Q&A box listed below in your Zoom window. Also, at the end of the session, you will see a QR code that will be to submit your evaluation survey. And then after the webinar, you will receive a post-webinar email containing today's slides, the recording, and again, that evaluation survey. We just want to remind you that your feedback is invaluable to us, and so make sure that you fill that out for us. Next slide, please. So we'll just give a quick overview of the Tri-Network's Cancer Prevention COP. Next slide. All right, so the Tri-Network Cancer Prevention Community of Practice is a collaborative effort between 3 CDC-funded networks. The first one is the Geographic Health Equity Alliance. Second one is Nosotros Voces Adelantez Network. And then for third, it will be the Self-Made Health Network. So our goal in this Tri-CCOP is to enhance the capabilities of national comprehensive cancer control programs, cancer coalitions, and allied partners in implementing policy, systems, and environmental change strategies that target root cause of health disparities leading to increased cancer rates. The Tri-CCOP aims to bolster interventions that address the needs of underserved populations to include low socioeconomic status, Hispanic and Latino communities, and geographically defined groups. Our focus revolves around 4 priority topics: HPV vaccinations for cancer prevention, improving the built environment and physical activity, broadband access, and ensuring that food and nutritional security. Next slide, please. So as we settle for today's webinar, I want to start by outlining our learning objectives for today. These objectives will guide our conversation and discussion and ensure that by the end of the session, you will have a comprehensive understanding of how the built environment impacts health specifically in the context of cancer prevention. So looking at what we aim to achieve today would be understanding the role of the built environment in shaping health outcomes, specifically in the context of cancer prevention. We would like to list specific examples of past policies with negative impacts on cancer prevention. We will understand the intersectionality of built environment approaches such as transportation, housing, and development patterns to address health disparities. And then we'll also be able to articulate how the Missourians for Responsible Transportation and their partners have used built environment approaches to shift health outcomes. As we move through today's presentation, I encourage you to think about how these objectives relate to your own experience and work. And also, again, feel free to ask questions in the chat box or at the end for these. Next slide. So now that all housekeeping has been done, I'm so excited to introduce today's speaker, Taylor March. He is the Executive Director of Missourians for Responsible Transportation. Taylor is dedicated to addressing transportation insecurity and inequalities with a focus on organizing and building meaningful relationships within community. Taylor brings close to 9 years of professional experience in the nonprofit transportational advocacy space. Taylor has worked at various levels in several roles over the years to advance the needs of people walking, rolling, and taking transit, from policy to government relations to grassroots organizing, door knocking, and youth education. Taylor brings a lived experience of a parent who primarily gets around without a car, and the engineer aspect of who has a deep personal understanding of street design and its impacts. He uses skills such as public speaking, community engagement, grassroots organizing, urban planning, and familiarity with local and federal transportation funding programs to help neighborhoods and communities create streets that address their needs. Taylor has led community engagement and technical planning events across Missouri using tools such like walk audits and pop-up traffic calming demonstrations. Taylor, we are so eager to hear your insights today, and I yield the floor to you.
Great, thank you so much. I'm excited to speak today. So got an exciting presentation for today. Look, these slides, you all can see my screen. Great. So today we're going to give kind of like an introduction to built environment approaches for addressing health. There's a lot that goes into this space, and so I'm going to be really quick. We're going to go through a lot of slides, kind of PechaKucha style, but long, and hopefully give you a better understanding of the ways in which the built environment impacts the health sector, and some of the ways that we've seen organizations and our organization has worked to address that and address some health disparities. We already talked about learning objectives, so I'll skip right past those. So again, I'm Taylor March. I'm the Executive Director for Missourians for Responsible Transportation. We focus on policy infrastructure, and we are transportation professionals. We're an advocacy organization, as was mentioned, an independent nonprofit, and we're focused in the state of Missouri. We were founded in 2018 by 4 partner organizations: Local Motion in Columbia, Missouri, Ozark Greenways in Springfield, Bike Walk KC in Kansas City, and TrailNet in St. Louis. And so each of those 4 organizations do respective work in a similar space in their urbanized areas. And we were founded to kind of pull all that work together, represent those groups, about 35,000 members at the state capitol, and work on policy work across the state and find areas of policy alignment through grassroots organizing in rural communities. Our mission is to be the leader in fostering strong communities that align advocacy efforts for streets, roads, and trails that work for all Missourians. We advocate for policy and infrastructure that ensure the transportation system is safe and convenient for everyone. And we do that because communities that are walkable, bikeable, and accessible have thriving public transit systems, are stronger, more equitable, happier places. They're better for business, and they're better for health, which is why we're all here today. Our current road design standards are, one, outdated, inequitable, oftentimes dangerous. We see a lot of crashes on them. inefficient, both in terms of moving people and in terms of tax expenditures on those. Hence the expensive, and also just unpleasant places to be. I think every community has a street that looks like this. This is kind of our typical street design that we see replicated across the United States to date. So to start, this is, and you can just drop it in the chat here. Anyone tell me what the #1 predictor of life expectancy in the United States is? Feel free to drop it in the chat what your thoughts are, if anybody knows. Somebody got it right off the bat, zip code. Okay, so you guys are already primed for this. This is great. I bring this up, this image, if you search healthy on Google, this is one of the first images that comes up. And I think it's really interesting how many of the things within this image focused on individualized behaviors rather than zip code, as you all know. And so life expectancy at birth is very much a factor of place, and place is a factor of the built environment. So this is St. Louis. I'm based in St. Louis. I used to work for TrailNet here in St. Louis, so a lot of my community organizing and experience is going to be on there. So I'll use some St. Louis examples, but I'm also going to use some examples from other places across the state and across the country. One kind of illustrative example, there's 2 zip codes right next to each other that have a 10-year life expectancy difference. And some of the factors in that, a lot of it is income. So one zip code makes on average about 35,000. The other one is at 95,000. One of those zip codes that has a lower life expectancy is about, I think, 57% African American, and the other one is 91% white. And so why is that? We're going to talk about some of the structural basis for that. You all have already had the kind of primer on the social determinants of health, but today specifically, we're going to be talking about neighborhood and the built environment. This is closely related to others because transportation is the thing that connects everything, right? Healthcare access, social and community context, these are all influenced by the transportation sector because they're how we get between those other needs that we have. And again, we're working on upstream approaches. And so we're not talking about, addressing crashes with cars or individualized things. We're looking at things that can have a long tail impact within communities, really addressing the root causes of the inequalities that we see today. Some other graphical examples, just in terms of built environment and the impact to health. This is particulate matter in the United States. You can track this very closely with low and high income communities. So low income communities suffer the greatest burden when it comes to pollution. And also Black and brown communities suffer the bulk of the burden when it comes to pollution. This is, again, St. Louis City. We can really track anything based on those couple of factors. This is showing tree canopy, which has a lasting impact on the built environment and how pleasant places are, and a number of different factors. But this tracks very closely with that zip code map that we saw earlier. We see that more affluent communities, wider communities, have a greater density of urban tree canopy as well. Specific to cancer, I like to bring up the example of Cancer Alley in Louisiana. I think that the naming of it as Cancer Alley is an acknowledgement of how place determines health. The fact that we have a concentrated area of pollution along with residential areas. And while this might be a really extreme example of that, with these, petrochemical factories in people's backyards, this is by no means an anomaly. Every community that we've worked in, you can ask people, where do low-income folks, live within your community, and where are the main sources of industry and pollution? And those things will usually be right next to each other. And so we're going to talk a little bit about the history of why that is today. So, short history of streets. So this is kind of how our streets in the United States largely started, along kind of like common trade routes that people would travel. we can see kind of porches on the front of these buildings that are really starting to define what we come to know as today as the sidewalk, or like the frontage zone, where we have like benches and other street trees and furniture. As those evolved over time and those buildings were maybe replaced with higher structures, streets really were a shared space. This is the areas where goods would be brought into a community, but a lot of times this was also a place where people would meet. Trade was being done. Businesses were selling things out on the street as well as inside. And so there was a lot of activity and also a lot of like density in terms of the use along the street. We have lots of different kind of modes mixing here. We've got people on horses and carriages, people walking, but things stayed pretty slow within this space and mingled pretty well. And around 1900, really 1910 is when we start to see automobiles being introduced in the United States. And that really kind of disrupted that street pattern that we see today. The early cars, that were introduced were very much a luxury item for the affluent. The first kind of affordable, quote unquote, affordable car from Ford Motor Car, I think it's the Model N, cost about $600, which inflation adjusted to today is about $20,000. Be great if our minimum wage kept the same track. That's about what cars, an entry-level car today is. And so for many families, as it is today, that was out of reach. That was just simply not an attainable thing. And it was very much industry leaders, people with a lot of money who were able to afford these. And so right off the bat, we started to see conflicts between the street space that we have, car users, and people who were kind of using the street for walking and other means of getting around. We started to see a surge in people who were injured and killed. We coined the term car brain at this time. Very much when you're driving a car, the community is in your way. Whereas, if you're walking, you are a part of the community. There's an amazing kind of psychological thing that happens there, that all of a sudden you're trying to get somewhere fast, and that the rest of the community feels like it's in the problem. And so there was a lot of like newspaper ads and things things that were happening at the time, elevating the conversation of, hey, what place do cars have in our built environment? Is this something that we're okay with? In a very similar way to, for those of you that are in major metro areas, the scooters that came out about 10 years ago really disturbed the built environment space. And there was a lot of conversations about how do we use those safely, what's their place within our built environment. So there was a lot of conversations happening about how do we regulate cars? Should we allow them in the city center and things like that? And so the auto industry, those more affluent folks started to push back on that. We started to see kind of approaches to try and shift the blame when those crashes occurred to other people within the street environment space. Can anyone tell me, does anyone know why it's common to use the phrase car accident? Drop it in the chat if you know. We start to see things like, the jaywalking laws and stuff like that, which is a term coined by people who are driving in kind of the auto industry. And I'm gonna look at the chat here. Okay, so nobody knows why we call it car accident. So one of the reasons is this is about the time of the Industrial Revolution. Like I said, many of the folks who were owning cars were really affluent individuals. And so, in their Industrial Revolution and in their factories and things like that, one of the ways that they were concerned about workers who were getting hurt in injury in those environments. And so they talked to their lawyers and they said, if you call it an accident, that absolves you of that blame. And so when cars started to come around, they said, what do we do? And they said, don't call it a crash, call it an accident. That way, you're not liable, the car manufacturer is not liable. It shifts the blame onto other people. And so we start to see more kind of like messaging propaganda to that effect AAA was, started to put out messaging around children, kind of keeping children away from the streets. They started to fund playgrounds. This is actually one of the reasons playgrounds started to become popular, was a way to get kids out of the street. And so it started to shift that, if you're the one that's in the street, then, it's your fault rather than the person who's driving the car, who needs to be kind of paying attention and watching out for other people. So in the 1930s, there was the National Highway Users Conference. Group of auto manufacturers got together and started to try and come up with ideas to try and influence the United States to spend more money on roads. They wanted to see a greater share of federal spending go towards roads and streets, to make it easier for them to sell their products, and also, for people who were driving to get around. We start to see more and more propaganda again about like the way that the car is going to reshape the American landscape, and that it's really, this beacon of success. This all kind of originates in the 1930s. So in 1939, during the World's Fair, presented at that, there was this concept of Futurama. And so it was this very kind of future-looking cityscape with lots of big highways and things like that we hadn't seen before. This is a great photo that shows like some people like looking down on this model. But there was a couple of key things that were left out here. Can anybody, there's like three main ones, but I'm curious, anybody want to drop in the chat some thoughts of things that are missing from this this model of the future? I'll give it a minute or so. Shade, sidewalks, trees, grass. Yep. People is, we see cars, but we don't see people. So the cars are supposed to be kind of a proxy for the people. There's one important one that no one's mentioned yet. Curious if anybody else. Bicycles, yeah, people scaled stuff in general. Parking lots is the big one. So we have this giant, utopia of a kind of Futurama environment. We have lots of big roads, but we don't have a place for where those cars are going to go. And so it was a really overlooked portion of, well, we have this beautiful cityscape. What about when people are done using those cars and then transfer on to foot? So taking a step kind of parallel in time, the Federal Housing Administration was set up in 1934, which really provided home loans to Americans, specifically white Americans, to buy new homes. And so the loan terms that were created by the Federal Housing Administration, you can kind of see like the stereotypical image. We've got a white family, 2.5 kids, like, a dog, a picket fence. You've got this industry in the background, and it's kind of like an escape from the city. And so they start to kind of, in their marketing materials for home loans, really start to kind of create the idea of the American dream that we have today, in terms of suburban environments. And so, when we see the development patterns of a suburban landscape, that was very much created by the Federal Housing Administration, and the kinds of loans that they would approve, primarily for new homes. This wasn't, to purchase existing homes. It was a lot of times new construction away from the city center, because it was, thought that was going to be healthier for people. But it had some perverse impacts that we're dealing with today. In addition to that, we also have kind of a doubling down on that in the 1944 Servicemen's Readjustment Act, which is commonly known as the GI Bill. So again, home loans, business loans, again, for white Americans that are coming back from World War II, and primarily in suburban kind of environments. We see this is a ad from that time, somebody with a blueprint of a brand new house, and the yard and things like that. Happening at the same time was the practice of redlining. So redlining, and it sounds like we've got a pretty educated audience here, but redlining was a practice that basically you couldn't get a loan if the area that you were moving into was either majority Black or at risk of becoming majority Black. And so those were thought to be like riskier places for home loans. And so the insurance agencies would draw up these maps and literally color code them red for the areas that you couldn't get a loan. And so we can see this in the built environment today. Redlining has a long-lasting generational impact in terms of loan structures, and actually the ability to get comp properties in many places, St. Louis included, is still to this day affected by the practice of redlining because you haven't had home sales in those areas for such a long time. So while we think of this as a past practice, it is still very much impacting the built environment that we have today. Additionally, we had restrictive covenants. So that was a practice in which you could not, it was written into the actual deed of the property that you could not sell it to a Black family. And so this practice actually ended because of a case in St. Louis, Shelley versus Kramer. And so many of these things are kind of like retooling themselves as we go. But all this to say, you know, there was this kind of hope and promise for a brighter, more healthy future in the suburbs, but Black folks in the United States were oftentimes excluded from that explicitly through policy. We see that continued even to today with the practice of single-family zoning. These things have a way of kind of recreating themselves as they go along. And so many communities found that single-family zoning, while it is not racially explicit, has a way of perpetuating white homeownership above all else. And so we saw many communities when it was deemed that this was a constitutional practice, rezoned entire parts of their community to be, you know, 75% or more single family home zoning, where you could not build duplexes within this area. And so that created the development patterns that we're struggling with today when it comes to health in the built environment. In 1956, the Federal Highway Act was passed. This is the largest single investment of public works funds in the entire nation's history. We saw $25 billion invested over a period of 12 years, $25 billion a year over 12 years, what this bill authorized. That really kind of just massively reshaped our landscape. You know, creating interstate highways across the United States. This all at a time whenever, by most kind of historians' projections, maybe only 50% of folks in the United States even owned a car, but we were having a large public works project for that 50% that was coming from the taxes on everyone. And so this is not a kind of an unknown history. This divided neighborhoods. We saw this commonly go through, you know, blighted areas. You know, what made it blighted? It was folks that didn't have a voice. It was folks that were lower income, that were working more jobs, that couldn't, you know, attend the public meetings and things like that. And this very, very quickly subsidized the driving public. So we saw a massive increase within a span of about 10 years. We saw the car ownership in the United States jump from about 50% to 70 to 80% by the end of 1960. And, you know, all this through projects like urban renewal, where we saw entire neighborhoods, this is Kansas City, just kind of completely erased to make way for these large highway projects that made it easier for people to live on the outskirts of town and then drive in. Again, some just kind of photo examples of this. And like I said, this is not unique to any one community. This happened all across the United States. This all happened, so up until this point, this all happened during the Jim Crow era. So Voting Rights Act of 1965 why was it so easy for the built environment to disproportionately impact low income and Black folks? Well, because Black folks could not vote in most communities until this point still. In reality, with poll taxes and some of the literacy tests that were still being done at polling places up into this point, this was an easy thing for politicians to do because they were not representing Black folks in those decisions. They didn't have to. They weren't really allowed to vote in the United States until, and this continues today. But I just want to mention that specifically because when we talk about kind of the impacts of this, it's very clearly along racial lines. And so we'll see that kind of in the data overall from the built environment. This created car-centric zoning. So we talked about single-family homes. One of the things that also impacted was the creation of kind of a segregation of land uses. So we see more and more, big box stores, things like that, large parking lots. There's no housing anywhere in this photo. And so in order to get to these places, you are more than likely going to have to drive. The scale is also, expanded so that if you did want to walk, it would be much more difficult if there are even sidewalks within this environment to get to that place and to get your needs met. And so again, this creates what we see today as kind of the perpetuating landscape type and streetscape type of the American dream. Also, all of that on the background of nearly a third of the U.S. population does not have a driver's license. So even today, about a third of Americans either are too young, have a disability, or have aged out of it being safe for them to drive. And so the emphasis on car-only transportation has created an environment that we're basically leaving a third of Americans out. According to the World Health Organization, sedentary lifestyles are one of the main causes of mortality. And so we're seeing a massive increase in diseases related to sedentary lifestyles, cancer being one of those. And so it's something we really need to address through both policy and the built environment. So why don't more people walk, bike, or use public transit? It's at least partially to do about streets. We're seeing this is kind of a comparison of the two different development patterns and some of the ways to address this. So the conventional suburban development, where we've got a separation of uses versus what we see more commonly in older cities, places in Europe, and also kind of like new urbanist or smart growth style developments where we've got more of a mixture of land uses. And so not only does this get people closer to the things that they need to get to, like healthcare, healthy foods, things like that, but it also is much more cost effective. We haven't even really talked about the maintenance required for the vast amount of roads that we've created in the United States. And that is something that we're going to struggle with as a society moving forward, is keeping up all that pavement, because it is really difficult. We've spread out a whole lot, and that's going to have implications when it comes to the long-term viability. So hopefully it should be clear after some of those things that there are problems with a car-centric society. This is a great example of somebody walking on a street that clearly wasn't designed for them. There is no place for them to safely be. And luckily they're able-bodied and still have somewhat of an ability to navigate this space. Why are we so car-centric? This again is a street that I think we see very, very common in a lot of communities across the United States. I would argue it's partially about streets. We've talked a lot about kind of the planning, the housing, all of these things are intermingled. These are all systems. It's not really possible for us in the built environment landscape and in the work that we do to separate these things out fully. They're all interconnected with each other. So one of the approaches that we see being taken today to address these impacts is this concept of complete streets. Complete streets are streets that are complete for the different users that we want to see within that space. They tend to kind of have a hierarchy where we're focusing on what I would call our core transportation systems first. So walking, people with disabilities, children at kind of the top of that pyramid. And then kind of, they should work for transit users. They should work for people who are biking, and they should also work for cars. But we're kind of building the pyramid from the bottom down when it comes to complete streets. So why do street designs matter? They determine whether a street is safe and for whom it is safe. They create safety and convenience, which there's a lot of data to show like people choose the mode in which they travel and get around based on what is fastest and most convenient, right? Especially when it comes to transit and things like that, people choose to drive because we've created an environment where it's the fastest, easiest, safest way to get around. And if we were to change the built environment where walking or taking transit was that, such as New York City and places, we see people making different choices based on that. And it's largely to do with the kind of the built environment that we have. And it determines the accessibility of those basic needs. So from a health standpoint, again, getting to healthcare, getting access to healthy foods. We all know, there are areas that are food deserts and where you really can't get access to healthy foods, even if you wanted to, without a car, without driving out of that community. And so if a person doesn't have the capacity, either financially or because of disabilities or things like that, to drive a car, that's not an individualized choice anymore. That's something that we've kind of perpetuated with the built environment. So though that's part of the reason that it's important to focus on other modes of transportation as we plan for things. We see a lot of this in communities being kind of altered through new street design standards. So the city policies that look at things like driving lane widths, sidewalk widths, crosswalks lighting, all the things that make streets an inviting and pleasant place to get around outside of a car. Traffic calming, trees is one of those things that I mentioned earlier. Those not only create an environment where when we have a sense of enclosure from street trees, that helps to slow traffic down and make it a safer environment for everyone, but also it creates a much more pleasant environment for people to walk, create shade along the sidewalks in many of our increasingly hot communities. It mitigates stormwater runoff and helps us treat some of that pollution before it enters our storm sewers. And just overall, creates a much more pleasant and place to be. So complete streets will be safe for people who are walking, biking, riding, transit, people with disabilities, older adults, children. We kind of use this as the 8 to 80 scale. People of color and people who are driving will also be safe. As speed decreases, we see a lower incidence of crashes, and it's a much safer environment for everyone. So some of our work on built environment approaches. This is a sidewalk project that was done in Versailles, Missouri. So we were part of kind of the planning for this. This is, going over to a major elementary school. We've got a rectangular rapid flashing beacon. The sidewalk is set back so that we're not having to do curb and gutter at the same time. And just created a much more conducive environment for students to be able to walk to school within this smaller rural community. This is that same crosswalk, just from a different vantage point. We see projects like this is the Frisco Highline Trail, which is near Springfield, Missouri, connects Springfield. This goes through Bolivar. And so this actually is right next to a section that connects elementary school, high school. This is my colleague Jackson that's on the bike here, runs parallel to a major state highway. And we see students using this to get back and forth between school. as opposed to just driving. And so it's created an environment. It's an old railroad corridor where people can make other choices when it comes to getting around. This is a project that I was involved in St. Louis. This is an elementary school called Frable. Some of these approaches don't have to be big retoolings of places. This was simply some concrete objects, some painted bump outs to kind of constrict things visually down, slow things down, and highlight the fact that, you know, we've got kids crossing the street here. We also updated the curb ramps here so that people with disabilities can get across the street and know where that crossing is with the tactile pads. This is an example of Pleasant Hill, which is a community along a railroad corridor. You know, again, just showing some examples of built environment approaches that you know, are a little bit lower cost, more rapidly deployable. This community's used bollards to create kind of a separated area for biking, and it also works as a sidewalk space when people aren't biking there through their little downtown area, and is a really just neat way to do that. This is another area within that community that's done the same thing and created what otherwise would be kind of a continuous layer of asphalt, and created some division between people driving and people walking to make it a safer place for people to get around and make that a little bit more attractive in the interim as they pursue other options. This is Kansas City. You know, again, we see many kind of protected bike lanes, things like that going in. We've got scooters next to this one as well, where we've shifted the parking out, kind of repurposed one of those travel lanes as the parking lane, and then expanded to have a bike lane that runs along that curb that's much safer feeling. Again, in pursuing that 8 to 80, you know, this is a space where you know, I'd feel comfortable biking with my daughter, whereas like a conventional bike lane, something like that, it's just paint. I probably wouldn't take her on that at this point. She's not ready for that yet. But something like this might be an option for us. This is a example in Bloomington, Indiana, where we have one of those typical kind of 5-lane roads that we saw kind of in the beginning of the presentation with kind of the FHA perpetuated environment. We've basically made it right in, right out, taken that center turning lane and created an environment where a neighborhood, Greenway, Calm Street, Bicycle Boulevard, whatever term you want to use for that, where it's more prioritizing people walking and biking, is able to cross that street in 2 stages. So we've got rectangular rapid flashing beacons on the side, for people biking to kind of have a queue zone in the middle, and make that crossing in 2 stages that's protected by some concrete. This is in a community in rural Southwest Missouri called Knoll. They have a Tyson chicken processing plant, and had a lot of workers that were walking to the chicken processing plant for their shifts, and there's a major highway kind of route. And so one of the things that they did whenever they updated that road, they knew that that was a priority, and so they put a sidewalk in on the opposite side of that guardrail. And so it created a much more pleasant place. It feels a lot safer than walking on the shoulder of a highway. And just a much nicer place to be able to get around. This is in Kirkwood, Missouri. This is a tabled crosswalk. So an intersection where the entire intersection is raised up, and so it slows vehicles down. It also creates a much nicer environment from an accessibility standpoint. We actually don't have any ramps down. So if you're in a wheelchair, you're not going down and then having to go back up. It's all kind of at one grade, in addition to highlighting the fact that this is a space where people are going to be walking and crossing the street here. So this is a great example that we're starting to see more commonly used in places across the states. Another example of a mid-block refuge island with some curb extensions. So places where when we don't have cars parked, they still kind of pinch things in, slow speeds down. It really highlights the visibility of people trying to cross the street here. And so it's also a raised crosswalk across here. So similar to that intersection example I just showed, you know, it ramps up for people who are driving to really highlight the fact that you know, there's people that are going to be crossing the street here. Also, these, you know, mid block islands with this signage really does a lot to highlight the visibility that people are going to be crossing the street here. These have a really high yield compliance rate in studies we've seen across the states. Lastly, I want to show some kind of like lower cost and things that we've done on the community engagement side. So this is a road in Ferguson, Missouri that we did some community outreach on. There was some plans about updating this road. And so we brought out some tires and cones and mocked up. This crosswalk has been painted in with just like basically chalk paint. We brought out signs. And so this isn't, you know, like something that we're going to leave in place, but this is an attempt to kind of measure how drivers respond to this and also start to understand more what are the things that we need to do in this environment to make it safer and to make it feel safe and comfortable for people who are walking, biking. And this is also a major transit route. And so through this process, we learned you know, this is still 5 lanes we created a mid-block refuge island that really wasn't enough on this road to make that a safe and comfortable crossing. We were still having issues with cars, even with all this stuff out, yielding to people in the crosswalk. And so the final design that moved forward had rectangular rapid flashing beacons and some other things that highlighted that visibility a bit more. We also use this as an opportunity to engage with people who are already walking in this space and learned this wasn't the best location for this crosswalk. There's actually a bus stop that's closer to where this picture was taken. That was the main desire line of people trying to cross the street there because they could, you know, hang out, use their bathroom at this local McDonald's and then be able to cross the street closer to when their bus was coming. And, you know, they weren't going to deviate out of their way to go down to this additional crosswalk. This is another example. This is in St. Louis City. This is a pop-up demonstration we did along 20th Street and used a closed section of street with some duct tape and other things mocked up in that space to be able to kind of show, hey, this is what a streetscape section might look like, and engage residents along this corridor and businesses in what their priorities were in planning for this. And so we were able to kind of segment that feedback and show you know, the majority of residents, one of the primary things that we heard was people wanted more shade. And so rather than say, hey, we're going to take away parking, it was, how do we, you know, if shade is the priority and if speed is the things that you're worried about, how do we create, you know, a streetscape environment that allows for the things that you want to see in it? And so that allowed us to have a different conversation when it came to the engagement. One of the things I want to say in this is that, you know, engagement in these kinds of built environment approaches is critically important. We did not get to the place that we are here today with public engagement, right? We got here partially because of a lack of public engagement, because of a lack of the ability for people to have a voice in this process. And so twofold. One, we need to be doing things differently. We need to be engaging people earlier on in the process and having more conversations about what their priorities and trade-offs are, and also segmenting that data based on the intersectional populations that we want to see prioritized in these processes. This particular one went through a majority Black neighborhood. And so one of the things we did in the engagement process was we asked people to, you know, voluntarily say, what race do you live along the corridor? Do you live off the corridor? And so we were able to show that people with disabilities, people who were Black and brown, preferred the cycle track more than the shared use section. And so that was a way to really show, hey, this is consistent with what we're seeing in the public. And this is what the residents that we're really trying to elevate in this process want on this corridor. So that's one, is to segment that engagement. The other thing is that people are going to be skeptical, right? People still remember you know, their neighborhoods being demolished for highways, and they remember not being a part of that process. And so people are going to come to any built environment approach with a degree of skepticism that is understandable. And so we need to be acknowledging the past harm that's happened within the planning, zoning, transportation space, and proactively working with people to elevate what we want to see in the future. So with that, I've run through a lot of different information, and welcome any questions. And I'll also put up my my contact information here as we go too. Oops, sorry.
Thank you so much, Taylor. If anybody has any questions, you guys can come off of, no, you can't come off mute, but you can put it in the chat box, or you can put it in the Q&A and I can read it off to Taylor.
One thing I'll say is that we'll send these slides out afterwards. There's hyperlinked stories and things from different sources in the notes on all of these. So if you want to dig further, there's lots and lots of information that you can dig further on those too. What type of partners did you enlist? I guess the question would be, for which, is there a particular project or just in general? Please describe how you conduct your pop-up demonstrations. Yeah, so pop-up demonstrations we've seen as a really successful tool with several of our advocacy, partners. So we've actually created pop-up lending libraries across the state of Missouri now. We've got 4 that are housed in different geographic locations. And so those consist of like those tires and cones, tape, things like that. And then we created a guide. And so I can send that as a follow-up too, but there is a Slow Your Street guide that TrailNet put together. They were the first of our partner organizations to do that. And it talks about kind of the process for getting a pop-up demonstration organized. Sometimes some communities will require you to permit it to do that, and kind of when it's most valuable within the process. And so has some different thinking on ways to mock that up. And so typically for pop-up demonstrations, with the exception of that 20th Street one, most of the time we're modeling things that aren't drastic environmental changes. And so we're kind of maybe closing a lane of traffic at a time to model kind of in place, what a curb extension looks like, or painting in some crosswalks, and using that as a tool very early on in a project development phase. Oftentimes we're brought in by traffic engineers and consultants who are working on a project to understand like what are the things that people in the community want to see, because people don't, you can have as many public meetings as you want, people don't show up to those, partially because they're not really designed for people to be able to really meaningfully engage in them. They're like from like 4:30 to 6:30 on a Tuesday, and like don't have childcare and things like that. So if we really want meaningful feedback, we need to be going and meeting people where they are. And so a pop-up is a way to do that. It shouldn't be the only method, but that is one successful tactic. So we'll model that. We'll have a table set up that kind of talks about some of the project goals and things like that. Be really clear about what it is you're trying to accomplish. If there are non-negotiables in that, we are going to be expanding the sidewalk. We just want to know like what kinds of things should be in that environment. Make sure you're clear with the community with that, because the last thing you want is for people to show up and like have a bunch of ideas and you're like, oh yeah, we're not doing any of that. So just be clear about what things are negotiable and what aren't, and also make sure you do your homework and look into what past engagement has happened in a community. What have people already said about issues? I mentioned trees and speeding on that one. That wasn't information that we had to collect on that project, because we knew from past planning processes and things like that, people had elevated that. So don't go in without doing some of that background research as well. General partners. So we partner with our state Department of Transportation. We do a lot of work with our State Department of Health and Senior Services, advancing some of the CDC approaches for creating built environments that foster physical activity. We work a lot with transit advocacy groups. Like I said, those 4 partner organizations that helped found MRT. We really try and focus on kind of grassroots organizing among the disabled, non-drivers, people who are kind of like already struggling to get around within a community and pulling them into that process. But it's not one size fits all within the work that we do. It's very much different for every community. How is your work funded? So I mentioned we have some work that is funded through some CDC grants, again, trying to kind of promote those built environment approaches. We also get funding and support from those 4 partner organizations. So each one of them has a membership structure. And so they fund us to do some of the state level advocacy that they can't do on the local level. So I'll give a small example of that. We just were responsible for organizing a coalition that got Missouri's no texting while driving. It's a hands-free electronic device ban passed in Missouri. And so that was something that we heard from communities across the state. People weren't feeling safe on the streets, partially because of the perception and reality that more and more people who are driving are distracted by their phones. And so we helped put together a coalition to address that, because on the local level, the state had actually preempted local control of that issue. So in order to address that, we had to do that through our state legislator rather than just do that community by community. So that's some of the ways that we're funded. We also get some grant funding to advance things like that as well. Faith-based communities, absolutely. Those are really, really important on any project. And are also, in terms of meeting people where they are for community engagement, faith-based communities are a really important component of places that people already gather, that you can work to meet them where they are. Another message: what are ways public health professionals can easily engage with city planners or transit planners? It really depends. I think, one is to understand the way that projects happen within a community, and that's fairly consistent, but it is different a little bit state by state. The built environment is a place where we have professionals working in that space. So we have metropolitan planning organizations and rural planning commissions across the US that kind of do a lot of this work. And so that's kind of like the first space that I would work to get engaged in terms of, advancing these kinds of things. And so public health professionals can, reach out to those folks, understand some of the projects that are coming up, and kind of elevate some of the things that you're seeing from a health disparity standpoint. I think that would be a great way to kind of foster that conversation and dialogue. Also look for, a lot of communities will have like bicycle, pedestrian, transit advisory committees as a part of their transportation planning. And that's a great space for public health professionals to be on, to understand some of the ways and also elevate some of the needs that you're seeing within the community.
Perfect. Thank you, Taylor. I do think that is all the questions that we had. So again, thank you, Taylor, for doing this webinar with us. Remember, folks, we will be sending out a post-webinar email, so be on the lookout for that, and enjoy the rest of your day.
Thanks for having me.